Healing Lyme, the importance of facing the Herx. We're talking about short-term discomfort leading to a long-term recovery. So I'm talking about a case. This is part of a Common Sense Lyme series where I talk about cases and questions. I'm Dr. Cameron, so let's begin. The patient she had struggled for years with chronic illness. She avoided antibiotics because she was afraid of herxing. She was treated for multiple other conditions without success. Now, Herxheimer reaction is a temporary flare-up. When starting treatment, it might be triggered by a bacterial die-off, could be some other cytokines. Something's happening where you can have symptoms of fatigue, pain, fever, brain fog, and mood shifts. So it can be relevant. People can get quite sick, but there are also consequences of not getting treated. The diagnosis that she ended up being given missed the mark. She was diagnosed with fibromyalgia, chronic fatigue syndrome, mast cell activation syndrome, Ehlers-Danlos syndrome, leaky gut, gastroparesis, and mold toxicity. Went to multiple doctors, had multiple treatments, but she remained sick. What changed is that she went back to looking again at whether Lyme disease was a possible root cause. She elected to start antibiotic treatment after all, despite delaying it for a long time. Yes, she had a Herxheimer reaction, but she was able to manage it. She stayed on course, got through the Herxheimer reaction, and started to recover. So what's a Herxheimer may mean is that the immune system responds to the infection in some way. It's not a treatment failure, so as soon as you get a Herxheimer reaction, don't think automatically that you have a side effect, that you can't tolerate it. It's a sign that healing may be underway. So how do you manage Herxheimer? We're still trying to figure out what's the best way to manage it. Hydration and rest, anti-inflammatories may help, although I haven't found them that particularly helpful as for my patients. I often lower the dose, change the dose, start with a lower dose. Sometimes I'll add something for babesia, which is a tovacone. What do we learn from her recovery is that chasing labels like different diagnoses was not very effective and not helpful. She remained sick. She faced the root cause, which is an infection of Lyme. The discomfort was a turning point. She was able to turn the corner and get better. I frequently see patients who have been avoiding antibiotics for some time because they've heard about Herxheimer reaction. Herxheimer reaction is often anticipated, and I'm concerned with the risk of a chronic disease if they don't treat for an infection. Some people use the word Herx or Herxing for a flare-up that mimics the Herxheimer reaction. So it's used because there aren't any great words in English language that describe how patients can flare up out of nowhere. So thank you for joining me for this Common Sense Lyme series. Have a good day.